My name is Jean-Marc Quickly. I'm the head of Global Risk and Resilience at the Geneva Center for Security Policy. The GCSP is an international foundation based in Geneva, which is non-profit, and comprised of 52 member states, of which all P5 member of the UN Security Council. The GCSP mission is to promote international peace and security, to prepare and transform individuals and organizations so they can create a safer world. And the values that we support are impartiality, independence, and inclusivity. The center does that pursue this objective through several tracks: through executive education, research, public discussion, and as well as innovative fellowship program. We have an alumni community of more than 8,200 around 165 countries. When we started this webinar series 2 months ago, the number of people who had been infected was about 1 million, and there were almost 48,000 people that had passed away because of this disease. Today, this week, we have more than 4.9 million people that have been infected, which is almost a 5th time increase of this disease, and about 323,000 people have passed away, which is about 6.7 people who have passed away in the last 2 months. Today's topic, as I mentioned, is about the impact of the crisis on inequality and the future of SDGs. We have a very distinguished panel comprised of Ms. Brenda Killen. She is fellow and executive in residence here at the Geneva Center for Security Policy. She will talk about the relevance of the SDGs as the roadmap for recovery from the COVID crisis. Then we'll have Mr. Lawrence Haddad. He's Executive Director of Global Alliance for Improved Nutrition Gain. He will talk about how COVID-19 has exacerbated unequal access to nutrition. Then we'll have Dr. Elizabeth Mason. She is a co-chair of the UN Secretary General Independent Accountability Panel for Every Woman, Every Child. She will talk about the impact of the COVID-19 crisis on the poorest and the most vulnerable. Then we'll have Ms. Anne Killick. She's replacing Ms. Rup Haddad, and she is a chair of the NGO Age International and board member and senior fellow of Women in Global Health. She will talk about how inequalities, including gender inequality in health, make the world more vulnerable to crisis. And finally, we'll have Mr. Andreas Schleicher, Director of the Directorate of Education and Skills at the OECD, and we'll talk about the impact of the COVID-19 crisis on learning and education. Last week's episode was about the impact of the COVID crisis-19 on the environment. And what we discussed was that probably in terms of the impact it will have on the environment, it will be the biggest drop in carbon emission since the global recession in the early 90s that was following the oil crisis of the late 70s. And this could represent a 6 to 8 times larger increase than during this crisis. So this is a rather positive development. We also discussed the fact that although this is positive, the impact on longer term could actually be detrimental because there could be an increase in the development and resumption of economic activities. And so, as we will see today, the COVID-19 crisis has the potential to have a tremendous impact on the so-called United Nations Sustainable Development Goals, which are a set of 17 consolidated targets that form a comprehensive framework for holistic global development. It brings together 5 pillars: people, planet, prosperity, peace, and partnership. Although these goals initially had a deadline of 2030, there is no doubt that the COVID-19 crisis will upend not only that timeline, but also the process involved in reaching these targets. For instance, If we take global poverty, the United Nations Department of Economic and Social Affairs, UNDISA, has already projected how the COVID-19 crisis situation can affect each of the SDGs, which will in turn have bigger ramification on the global mechanism of sustainable development. When it comes to poverty, the World Bank has forecasted that about 40 to 60 million people could end up or add to the people in extreme poverty. Such forecasts reveal that the COVID-19 is likely to cause the first increase in global poverty since 1998, when the Asian financial crisis hit. With this new forecast, global poverty, the share of the world's population living on less than $1.9 per day is projected to increase from 8.2% in 2019 to 8.6% in 2020, or from 632 million people to 665 million people. The region most affected by this will probably be Sub-Saharan Africa and South Asia. Another study that was conducted assumes a 5% contraction in per capita income. The world, if that is the case, the world could witness a potential increase in the number of people relative to 2018 figures of more than 80 million for the $1.9 per day poverty line, of more than 130 million for the $3.2 per day standards, or of almost 124 million for the higher line of $5.5 per day. But if the contraction is not 5%, but 20%, then this figure could increase by and reach 420 million, 580 million, and 520 million people at the global level. So therefore, the potential impact of the COVID-19 crisis poses real challenges to UN Sustainable Development Goal of ending poverty by 2030. And a last example is the education sector. 166 countries have implemented countrywide school and university closures. More than 1.52 billion children and youth are currently out of school or university, representing 87% of the world annual school and university student population. This has obviously clear education consequences, but also it has other social consequences like on nutrition and other issues. So this webinar, I think, is very timely to discuss how what will be the direct and indirect impact of the COVID-19 crisis on the UN SDGs. And to start this discussion, I let Brenda to share her thoughts about the relevance of the SDG as the roadmap recovery for the COVID-19 crisis. Brenda, the mic is yours.
Thank you very much, Jean-Marc. And I'll just pull up my presentation. Is that visible to everyone? Okay, assuming everyone, yes, I can see some nods. So thank you, and thanks to everyone for joining us. And as we've just heard, the COVID-19 pandemic has created a crisis not just for global public health, but for social and economic prospects worldwide. And these interrelated crises are building on existing inequalities, and they're making them worse. And as we're going to hear from our panelists, they're hitting the poorest the hardest. So even though we have been in lockdown, the challenge of sustainable development has not. And so as we've heard in previous seminars in this series, climate change, conflict, violent extremism, humanitarian emergencies have not gone away. So not only were we already off track by the end of 2019 with the Sustainable Development Goals and the related Agenda 2030 commitments on climate and development finance, the COVID pandemic has put us further off track, as we just heard from Jean-Marc, and as is set out in the UN Secretary General's response, these socio-economic impacts of COVID-19. They're attacking every single target, they threaten every single goal. And as you'll hear in this seminar, inequality has made it worse. The differential impact of the crisis on the haves and the have-nots is widening existing inequalities, and it threatens the life chances of future generations too. So in this context, many voices are calling for a short-term focus only on the economic and the health fallout from COVID, so emphasising domestic rather than multilateral action. And certainly as economies go into recession, we can expect to see aid budgets shrink and to see resources shifted into the search for a vaccine at the expense of other SDGs. And in fact, even those who fully support Agenda 2030 are suggesting that the deadline for the SDGs should be delayed by 2 years or more. But this misses the point. In fact, the sustainable development agreements that make up Agenda 2030 are needed now more than ever before. So I'm going to outline a few issues to explain why these agreements are the roadmap out of the crisis. So firstly, it's important to remember where the SDGs come from. They emerged from decades of global commitments on all aspects of development. And they were preceded by the Millennium Development Goals, which were kind of accidentally invented by the OECD because they wanted to keep a tally on the number of commitments made at UN conferences from Rio to Beijing to Cairo and more. And the MDGs actually set some goals for development assistance. So they mark the beginning of global governance for international collaboration and international cooperation after the end of the Cold War. So the SDGs built on this, and the core agreements on sustainable development, climate and financing for development that make up Agenda 2030 encompass the MDGs, as well as associated agreements on humanitarian assistance, resilience, small island developing states and more. But crucially, the SDGs brought in the voice of citizens, including youth, and they also brought in business. So while the final agreements were hammered out in New York, Addis and Paris, they were shaped by people. And as you can see on the left-hand side of this slide, more than 7 million people from all parts of the world contributed to the My World Survey 2015 that helps to frame the SDG agenda. And we can see from the results of that survey on the left and from the SDGs on the right, what actually matters to people. We can see that people care about a good education for their children, healthcare, job opportunities, nutritious food, honest, responsive government. They care about fairness and inclusion. They support the commitment to leave no one behind. And on this slide, we can see Parisians cheering health workers. We can see protests in Malawi about the lack of protective equipment for doctors and nurses. And we can see that ironically, 2020 is the year of the nurse. But these images underline the fact that people are still concerned about issues of fairness today. They're concerned that we don't value our frontline workers, that the poorest are losing the most, and that our children's health, education and life opportunities will suffer. So the SDGs are definitely still valid for a post-COVID roadmap. And getting back to that proposal that we delay the SDG target date, we can't do that. It's not the Eurovision Song Contest. It's not a fixed amount of work. It's a transformation. And this slide is to remind us that, probably most importantly, we must not treat lightly, we must not dismiss the legitimacy of Agenda 2030. So for all the challenges of unwillingness to cooperate internationally around climate action, financing for development, or gender equality that we see today, we shouldn't forget that these agreements in 2015 drew support from 193 world leaders. So not only are they based on decades of globally negotiated UN conventions, with inputs from millions of citizens, businesses and investors worldwide, and a universal approach that applies equally to rich and poor countries, they were backed at the highest level by pretty much every single nation on earth. Even if we thought we could do better, we would never be able to achieve an agreement of this scale and ambition today. And there are huge risks to global security of undermining what is the most legitimate global social contract we have ever had. And it's one that enshrines the commitment to reduce inequalities in Goal 10. We have one chance to build back after COVID-19, and Agenda 2030 is the roadmap. And I've included this slide, this quote, which was in the Guardian newspaper in March. It was a letter from an Italian author in lockdown to the British population and highlighting the challenges to come. And it captures how COVID is widening social rifts and inequalities. So we've all been in this together, and we now realise how much we rely on each other for health and well-being. But we emerge from lockdown with vastly different prospects, shaped by pre-existing inequalities. And as Francesca says, class, however, will make all the difference. The boat in which you'll be sailing in order to defeat the epidemic will not look the same to everyone, and is actually not the same for everyone. It never was. So many people will come out of lockdown, they'll have lost everything. And without rapid action, the same goes for their children. And that is a major threat to global security. And so with no vaccine in sight, we're entering a period of uncertainty. And as this slide illustrates, there are new crises to come. And there will be a need for all citizens to make further sacrifices for the sake of everybody's health and well-being. Just this week, the World Economic Forum warned of the risk to global security of inaction. And they've stressed that we don't have time to plan, we need to act. So the world needs a roadmap now that speaks to all of us. Unfortunately, we don't have to wait and we don't have to ask permission. We already have this roadmap in Agenda 2030. It's big, it's bold, it's ambitious, and it's legitimate. So let's use it. Thank you.
Thank you, Brenda. As you mentioned, the SDGs are not the Eurovision Song Contest. They cannot be delayed or postponed. So you mentioned that, laid out the fact that this is probably one of the biggest agreements ever achieved. It relies on millions of people input and states agreement, and therefore we need to act now. So I think this was a very good introduction to discuss specific issues of the SDGs, and I pass the mic to Dr. Lawrence Haddad.
Thank you, Jean-Marc, and thank you, GCSP, for hosting this event. I'm very pleased and honored to be here. I don't have any slides for you, but I have 4 major points to communicate in the next 8 minutes. First point is, many of you may not be familiar with what nutrition is, so I want to just briefly tell you a bit about what nutrition is and how it arises. Second, I want to tell you about the impacts of the crisis and the response to the crisis on hunger and nutrition. Third, I want to talk about some of the things that we should be doing to mitigate that impact. And fourth, I want to have a sort of a footnote or an end note about the role of the legacy of this crisis and how the legacy will be carried via very young children throughout their lives and to next generations if we don't do something about it. So first of all, malnutrition, the opposite of good nutrition, comes in many forms. Sometimes it comes in the forms of UNICEF adverts and Save the Children adverts, where you see very thin children, skin and bone. They look like they're about to die, and very often they are about to die. But it can also come in different guises. It can come in forms that you can't see very easily. Micronutrient malnutrition, not enough zinc, iron, vitamin A, vitamin D, vitamin C. You don't look terribly different until it's very critical. And then, of course, there's things like obesity, overweight, and diet-related diseases, hypertension, and diabetes type 2. All of these different types of malnutrition are driven by an interaction of poor quality diet. You're either not getting enough food, you're not getting enough of the right kind of food, or you're consuming too much of the wrong kind of food, and an interaction with a poor health environment. You're not getting access to healthcare, you're living in an environment where you can't get clean water, there's sanitation, open sewers are everywhere. So it's this interaction of poor health environment and poor food environment. It's a very serious condition. 1 in 3 people worldwide are malnourished. It's the #1 driver of the global burden of disease, poor diet. So the #1 driver of the global burden of disease, and the economic consequences and the cognitive consequences are far-reaching. So what's the impact of the crisis and the response to the crisis on these things? Well, we think there are 3 pathways. It's pretty obvious what they are. The first one is just a massive collapse in income. The World Bank estimates 5%. I've seen 10% estimates, drops in GDP per capita. And of course, those percentage drops will be bigger for poorer people than they will for people like us on this call. They will lose their jobs. They already spend 50% of their money on food. The price of food will be going up, skyrocketing, especially for fresh foods. So the first thing is income. If people don't have enough income, they can't buy the right kinds of foods or enough food, and they can't get access to healthcare, clean water, and sanitation. Second thing is, unlike the food price crisis of 2008, where it was essentially drought, biofuels, the price of oil, sort of making it really hard to produce enough food, the response to the crisis has sort of decimated the whole food system. Everything from input markets, output markets, processing, transport, storage, marketing, retailing, everything has been disrupted. And so that means the supply of food from where it's grown to where it needs to be consumed is completely uneven. You see piles of rotting, perishable food in one place and shortages of perishable food in other places with skyrocketing prices. The third way, and that's obviously very bad for malnutrition, the third way malnutrition is being affected is through the inability of the health system primarily to deliver essential nutrition programs, immunization, antenatal care, supplements through prenatal visits, vitamin A supplementation, fortification of key foods, breastfeeding promotion. These kinds of programs are being decimated again. The coverage is being lost because the health system is so focused on the COVID-19 crisis. So these three things together are generating massive impacts. The World Food Programme estimates an extra 135 million people will be plunged into acute hunger this year. The World Bank and various other estimates of poverty, extreme poverty, are, as Jean-Marc said, about 50 million from the World Bank, 130 million, 150 million from UNU wider, and there's a bunch of estimates in between. And $1.9 a day is extremely poor, and people on $1.9 a day are typically hungry or malnourished. So it's going to be a very big impact. The estimates I've seen on stunting and wasting, these are things that affect kids under the age of 5. It literally transforms the way their bodies look. They're either too thin or they're too short, and those are important markers for immune system response being devastated, and for cognitive development also being devastated. I've seen estimates of those going up, wasting going from 40 million kids to 50 million kids, and from stunting going from 145 million kids to 160 million kids. This is just in the last 3 to 6 months. So big impacts. And what you have is you have malnutrition, kind of existing malnutrition supercharging the virus, because malnourished people are more prone to infection of all types, including coronavirus. So that's not good. You've got diabetics, those with hypertension, those with other kinds of chronic diet-related diseases, also suffering higher severity once they've caught it due to comorbidities. So you've got pre-existing malnutrition supercharging the impacts of the virus, and then you've got the response to the virus supercharging the malnutrition. So you've got malnutrition, the virus and its response, and more malnutrition. So you've got this massive inequality machine that's being driven by malnutrition. So what to do about it is my third point. Well, the first thing to do about it is to alert policymakers and the multilateral system, the bilateral system, the governments, that if you don't deal with the food system, you are going to win the health system battle, but you are going to lose the food system battle. And when you lose the food system battle, there is literally rioting in the streets, and it's a massive security issue. So you have to somehow strike a balance of fighting on not 2 fronts, but 3 fronts. Most governments are trying to fight the health system battle, the economic battle, but they also need to fight the food battle. And luckily, the food and the economic battles they overlap, but not entirely. So in the health system, don't let all your resources get sucked into COVID-19. Don't forget about doing the basics, the fundamentals, immunization, promoting breastfeeding. These are really important programs that need to continue even in the midst of COVID-19. Second thing, you need to keep your food markets open. You need to keep them working. If you don't, food is going to rot in one place and be scarce in another place. On average, you'll be fine. But of course, you know, people with their heads in the oven and their feet in the refrigerator are also fine on average, but of course they're in lots of pain. So averages don't work here. You need to make sure that food is getting from where it's grown to where it needs to be consumed. And that means supporting small and medium enterprises that make and move and process most of the food in low and middle income countries. It means keeping essential workers in the food system healthy and well-fed and working. And it means keeping markets, especially wet markets, open, because very often wet markets are closed due to food safety scares and infection and lack of protocols and lack of protective personal equipment. We need to keep the markets open, keep the SMEs going, and keep the food system workers healthy. And the third thing we need to do is to keep social protection programs going. Billions are being spent on social protection, often cash transfers. What can we do to link the cash transfers to the production and consumption of nutritious foods? So this is the third thing that we need to do. And the fourth thing, and I'll finish up now, Jean-Marc, is again, keep food and nutrition, keep SDG 2 in the headlines. It's who'd want to be a politician at a time like this? Who'd want to be a business leader at a time like this? But you know what? This is what this moment is defined for leadership. So this is the moment where people have to lead and they have to come together and they have to be able to fight battles on more than one front. And we need to help them do that. We need to give them the right information, the right arguments, and the right advice on what to do and when to do it. My final point is about children. I've heard a lot about we need to, you know, every crisis is an opportunity. The Chinese symbol for crisis is threat and an opportunity, and that's absolutely right. And so there's a lot of talk about bouncing back better, building back better, and all that sort of stuff. And that's really, really important. But you know, for very young children under the age of 2, they can't bounce back better. If they are damaged by this crisis and the response to the crisis under the age of 2, a lot of the systems that they're building, think of wet concrete that is hardening. Any impression on that wet concrete is there forever. And so if those immune systems, if those cognitive development functions are damaged in this 2-year period by COVID and by the response to COVID, that will last forever. That will be a legacy that those children will take forever, and they will pass it down to their children, because we know malnourished people are more likely to give birth to malnourished children. So that's the legacy that we have to deny this crisis. We have to put very young children first and protect them first. And if we do that, that can be our legacy. Thank you, Jean-Marc.
I'm sorry, Andreas, actually, you're on mute. May you please unmute yourself? Thank you very much.
I'm so sorry. And first of all, thanks to GCSP for hosting this. I think it's great to bring so many different perspectives together in this discussion in the security context. One of the first policy responses to COVID has been school closures, and they do have an effect on the spread of the virus, but actually it's quite modest. You know, the action has been quite drastic with strong consequences for children, whereas the benefits, you know, compared with household quarantine, case isolation, and so on, are limited. And I think we should be conscious of this to balance the short-term costs and the long-term benefits of those kinds of policies. If you think about it, we have basically 1.5 billion students and their parents affected by school closures currently. Of course, you know, remote learning has come into play. It has worked for some students, but certainly doesn't address the many social functions of education. And of course, as you imagine, you know, access, use, and quality of online resources have further amplified inequality. For young people with access to technology who are, you know, well prepared to learn on their own, who have parental support, this is all liberating and exciting. But for people without access, without preparation, without support, they're left further behind. I think that's something of real concern. Accreditation, you know, is at stake. We do not know how to certify and recognize learning, which risks leaving a generation of young people stigmatized, and so on. That's basically the reality, and schools will be reopening, and that's already happening in a number of countries, but there are significant disruptions that are likely to remain permanent. Obviously, funding is going to be an issue. The global recession will hit middle and low income countries hardest, but first directly domestically, but also in terms of reduced foreign aid flows. That's already been an issue before the crisis, so certainly going to be amplified. And we also know that the scenario of just returning to the status quo is not what anybody would want, because that status quo hasn't been working before for many countries, and certainly will not mean reaching SDG 4 on education. So this is also the time to think harder about how to raise productivity, how to do things differently, and I'm going to come back to this at the end of my presentation. So first thing you need, when you talk about online learning, is the kind of environment at home, and you can see on the left side in a number of countries that's a given. Not more than 9 out of 10 students are equipped, but you go to countries like Indonesia and the Philippines, and even in middle school, you can see a quarter or more of students being left out. I also mark in orange and red the gap between disadvantaged and privileged kind of social contexts. You can see also how even home access is amplifying social disparities. Second thing you need is a computer, and there you can see very much the same picture on the left side. If you're in Denmark, in Slovenia, Norway, you can take it for granted. If you go to the Dominican Republic, to the Philippines or Indonesia, you are basically around 40, at best 50% of young people being equipped, and again with huge kind of social disparities. And that's sort of the starting point for this kind of remote and online learning. Then you get to teachers being prepared, and that's the kind of human capacity gap you can see also here in the judgment of principals. In a fair number of countries, our schools, even if they have the technology, are simply not ready to implement alternative forms of learning. And what's interesting here is that's not just a matter of wealth. You can look at the last one here on the list, is Japan. A country, a high-tech country, has all the technology, all the money, but it doesn't have the people ready to deploy technology. On the left side, you go to 4 provinces in China for which you have data. It's the number 1. So in the same world region, countries tech-savvy, very unevenly prepared for the kind of things that are going to come up. So this is not just about money, it's also very much about the human capacity in education systems. And you talk about online platform, very much the same story, huge disparities across countries between social groups. So there's a lot of talk about alternative ways of learning, distant learning, remote learning, but the reality is really that this is going to work well for certain groups of students, certain groups of schools, but actually leaving other schools further behind. When we've tried to quantify this, but we can also see that students with a disadvantaged social background, they are less likely to have positive feelings of their life, less likely to have that kind of growth mindset that enables them to get beyond the crisis. They're less happy with their lives. They feel a lower sense of belonging. They're more exposed to bullying. They are typically in schools with a poorer disciplinary climate, with less enthusiastic teachers, and with a less positive social environment. The only aspect where we find something positive is that often teachers are more inclined to actually be looking after those students from disadvantage. But here you can see really how you come from a disadvantaged background, and the system around you doubles down on this and reinforcing social disparities. And that's the reality in which most of the young people that we have in the 80 countries with comparative data are really in. So what does it mean? Here you can see the distribution of learning outcomes as measured by our PISA assessment. In yellow and green, that's sort of basic and good. And in red, you have the share of young people who are really very severe underperformers. Now, and this is basically data from before the crisis. So this just shows you the magnitude of the challenge that we already have in kind of peace times. And when I said, red area basically means you don't read as well as what you expect from a 9-10-year-old child. You basically have just, maybe mastered technical reading skills, but certainly not levels of skills that you need to be able to learn. Now, if you just think about this sort of severe underperformance in education, basically those kids are unlikely to ever get on track with SDG 4, because SDG 4 is basically, you know, the horizontal line. So those students are already left significantly behind. If you could fix that, actually, you know, we have sort of calculated the cost. You take a country like Tunisia, where the bar is longest, no? And you can basically see we are talking about almost 7 times the size of Tunisia's economy that actually is currently lost in terms of long-term added economic impact if everyone in Tunisia would at least reach SDG 4, basically get to the horizontal line. So this is the kind of high cost of low education performance that this crisis is currently amplifying. You take a country like Mexico, and it's still 5.5 times of the size of the economy basically being wasted because too many young people are not reaching even baseline performance. Now, and it's not just developing countries. You look at the United States, also there, you know, on average, things look good, but you have a very significant share of extreme underperformance in that country. And these are only the kids who are in school. I'm not even talking about those who are not, don't have a place in school. And you can really see we're talking about significant economic potential being lost over the lifetime of those countries. Now, UK, another of those stars. Now, nobody would think of the UK as an underperforming education system, but again, when you look at distributions, a lot of children being left behind, and that is exactly what this crisis is reinforcing. And even you look to the star performer in education, Singapore. Even Singapore has a share of young people not on the track to achieving SDG 4, and that is also almost equal to the size of Singapore's economy in terms of long-term economic kind of losses. This just gives you a sense of the magnitude, the economic dimensions that we're talking about. You can add to this social consequences, you know, lots of kind of variables that are correlated with this, but this is simply in terms of lost money on this. The only positive kind of news that I have is actually that we do see also in the data some very positive examples. Let me just pick one country from the middle. That's the Slovak Republic. And when you look actually, and it's a country with extreme disparities, social disparities within the system. And you can see basically here, what you see on the chart is the gap between the 10% most privileged students here in green on the top, and then the 10% most disadvantaged students. You can see basically in a small country like the Slovak Republic, you can see the entire world in terms of the quality of learning outcomes. You know, some people look at this and say, well, there's nothing you can do about it. But then you look to a country like Portugal, and you can see that the students with the same kind of level of social disadvantage like in the Slovak Republic, they almost perform at the average level. And then you look at the 10% most disadvantaged students in 4 Chinese provinces for which we have data. Admittedly, you know, these are wealthy provinces, coastal provinces, but you know, you can see basically the 10% most disadvantaged students in that in those 4 Chinese provinces do as well or close to where you see the wealthiest students in some other countries. So I think that shows clearly that we can do better, that we can, you know, better align resources with needs. And some countries are on a quite promising track to actually make that happen. We see the same thing by geography. Here you can see the relative share of performance variation between and within schools. And you can see, for example, in a country like Finland or actually many of the Nordic countries, the closest school is always the best school. So these countries have actually managed to even out social disparities in society, in income, in terms of access to school. You can see on the other side of the equation, in countries like, you know, Israel, Lebanon, and the Netherlands, huge disparities between schools. The school where you get to basically is almost, you know, determining the outcomes that you're going to see later on. But the variability across countries, irrespective of economic background, gives us clear indication that we can do better. Now, what are the kind of policy responses that we can imagine? I think the first question really is how we can make individuals and systems more resilient. I mean, this crisis is not the last one, and what this has really shown that the kind of institutional structures that we have, you get very, very quickly disrupted and become ineffective. And I think developing more frontline capacity is going to be absolutely key, but also to shift greater emphasis from a pure focus on academic learning on more social and emotional outcomes of learning. I think that's something that we realize at this moment, that we need to get a better balance right in the short term to make individuals more resilient, but also in the long run to develop those kinds of knowledge, skills, attitudes, and values that are going to be crucial for tomorrow's time. Equity and educational opportunity, as I have shown, some countries are doing far better than others in terms of aligning resources with needs. And this is not a matter of level of spending. This is really about basically how you get, talented teachers in challenging environments and align resources with needs. I think we have a lot of really good insights now what makes education systems provide more equitable opportunities. There's actually almost no correlation between the average performance of a system and the degree of equity and opportunity. Some of the highest spenders have the largest kind of inequalities, and some low spending countries have done remarkably well to even out those kinds of disparity. I think the bigger questions in the long run are how can we develop more innovative education systems and draw better on digitalization. I think education is still one of the sectors that is furthest behind in terms of using the innovation potential of digital technologies. Simply, our current model of production is so ineffective that unless we raise value for money in education, SDG 4 is basically out of reach. The economic prospects of countries are getting worse, not better. So I think we need to really look into better ways to strengthen value for money, and that means doing things differently. And technology certainly should be part of that equation. I leave it here. Thank you very much.
Thank you very much for this presentation, and sorry that my connection cut right after Lorenz. But if I can bring the two presentation together, I think the common point between the two is that this crisis has the potential to magnify some already existing disparities, and as Lorenz was mentioning, that malfunction supercharge the COVID-19 crisis, but then this crisis also supercharged malnutrition. Probably the same could be said about education, but there are hopes for that, and as Andreas just showed, that technology could play an important role. And for those who did not attend episode 3 of this webinar series, the episode 3 was about the role of technology, the good uses and the misuses of technology during this crisis. I want also to remind our viewers that you can ask a question on the Q&A tab. I saw some people raise their hand to speak. Instead of speaking, what you can do is just writing your questions, and then after all speakers have delivered their opening speech, we will have a Q&A round. The next speaker is Dr. Elizabeth Mason. Elizabeth, the mic is yours.
Thank you very much, and delighted to be with you this afternoon. Thank you very much to GLSP for organizing this seminar. So I'm co-chair of the Independent Accountability Panel for the Secretary General's Global Strategy for Women, Children and Adolescent Health. And just very briefly, the global strategy, there was a first one launched for the acceleration of the MDGs, particularly MDGs 4 and 5 in 2010. And with the advent of the SDGs in 2015, the global strategy was renewed and updated towards the SDGs, with indicators aligning with the SDGs, and importantly to include adolescents. So it's women, children and adolescents' health. And the role of the Independent Accountability Panel, which has 10 members from across the globe, is to look at the progress of women, children and adolescent health towards the SDG indicators across survive, thrive and transform. So the indicators go across these three levels. As such, the panel was preparing their 2020 report for a review as to what the progress in women, children, adolescent health is for launch this year when the COVID crisis hit. And so what we have done is to look at the progress, but also to look at what the implications of the COVID crisis are on the progress, and whether it will further stall or have a what sort of impact it can have, and what can potentially be done in order to ameliorate that impact. We have looked at inequities across these three areas: women, children, adolescent health, and we've also looked at some and undertaken some case studies. So I think to start off with, maybe just to say that already prior to COVID, there was round about a 20% progress lag towards the SDGs for women, children, adolescent health. Now, just looking at, I'll go into looking at some of the individual targets at in a minute, but some of the issues were that less than half of the world's population have full coverage of essential health services, obviously including those for women, children, adolescent health. Over 900 million people were debilitated by catastrophic health expenditure. And that almost goes without saying that it is the poorest that suffer from these catastrophic health expenditures when they become ill. And the universal health coverage differences between countries is also seen within countries, depending on geographical settings, on wealth, on sex, on education. So all of the different parameters show inequity across the access to services and the resultant indicators. So the other thing maybe just to say is that globally, mistrust was pervasive, driven by the growing sense of inequity and unfairness, and people themselves distrust the government. They distrust the private sector, they distrust the media, and they distrust, the issues around whether they themselves will be able to be equally treated or treated with an equitable sense. And was a growing sense that the global economy is geared to making profits for the few at the expense of the many. And so underlying this is the situation once the COVID pandemic struck. And what has been clear to see that in rich and poor countries alike, that the health systems were unprepared, that the inefficiencies, the ineffectiveness, and the inequities are being compounded. And we can see this, that very few countries have made good decisions in terms of the response to COVID-19 and are able to cope in a sense in which they have the trust of their people and are able to have kept the number of cases and number of deaths. I won't go into which ones those are. I think we all know them. But now we see that there are further risks to the health of women and children by the very policies that have been taken by countries to reduce the spread of the virus, which, if they had actually been well prepared in the first place, they may not have had to undertake. So maybe to go into a little bit of detail here, countries have gone into lockdown. More than 166 countries with billions of people under lockdown. An estimated at least 10% reduction in contraceptive prevalence. Women can't get access to their contraceptives. If they can't get access to their contraceptives, they're at risk of unwanted pregnancy or unintended pregnancy. If they're at risk of unintended pregnancy, then are they able to get access to abortion, or do they resort to unsafe abortion, or do they continue with the pregnancy and then be potentially at risk of death or other complications during delivery? So there is an estimation that potentially there could be an extra 28,000 maternal mortalities on top of the already 300,000 that there are each year, and potentially 168,000 newborn deaths on top of the 2.6 million newborn deaths that are already occurring. Another effect on women is domestic violence. We have already seen that there is an increase in the prevalence of domestic violence during the lockdown, and that particularly affects the poorest women. In the UK, they've seen a 50% increase in death from domestic violence in the first 6 weeks of lockdown. They monitor that closely, and they have now put in place extra funding, but in many countries, the situation of violence in the home is not receiving the attention that it needs. And in children, we've already heard from Lawrence that they are at risk of undernutrition, but vaccine programs, are they able to access their vaccinations? And if not, will the countries be able to catch up with the vaccination in time before there are epidemics? We have already seen measles outbreak prior to COVID-19. Will they be able to catch up, or will there be further outbreaks of other vaccine preventable diseases? We've already heard about the malnutrition and the issue around access to safe childbirth practices. Can the women actually get to the facility, and is the facility safe for childbirth? And will there be not only further maternal mortalities, but stillbirths and neonatal mortalities? We've heard about school closures, adolescents and young people and their issues around learning. But however, they may also have face greater exposure to physical threats. Social isolation may exacerbate mental health issues. There are reports that there is increased female genital mutilation, and the numbers have soared in countries such as Somalia during this lockdown period, because the children can't escape and they are not in a safe place when they're at school. We know that health systems and the health facilities have been overwhelmed by COVID-19 cases, and have they put in place a red zone, a green zone for the uninfected and the infected? And what does that say in terms of people's perception and people's utilization? Where it is closely monitored, there has been a dramatic drop-off in service users who would normally use the service, but are not going because they're afraid. They're afraid that if they use the service, maybe they will get infected. They're also afraid to go out of the house because they've been told not to. So a combination of factors is actually reducing the utilization of services. And then the issue of rights and accountability. COVID-19 in some countries is being used as an excuse to suppress human rights and to exacerbate, and where human rights are already flouted, then it is exacerbating issues in those countries. We saw a beautiful picture from Brenda on health workers being clapped and applauded, and in many of the high-income countries, there is clapping and applauding of the health workers. However, in some countries, health workers are facing stigma and discrimination. including losing their homes, because people are afraid and they think that they are the ones that are spreading the virus. So communication and issues around communication is having a devastating effect on the health of people, and particularly the health of women and children. We have within our report looked at the mortality rates for women, children, adolescents, and have prepared league tables based on countries' income. And we see that according to the country's income, we've put the countries into 4 income groups, there is vast difference in countries' performance, notwithstanding their same level of income. And of course, from the top to the very bottom, there is at least a 500 times risk of maternal death from 2 at the lowest countries such as Norway, Poland, Italy, to over 1,000 per 100,000 in countries such as Sierra Leone and South Sudan. So we also have seen that in countries such as Tanzania and Nigeria, both countries in Africa, both spend the same amount on healthcare. However, Nigeria has double the mortality for children than Tanzania. And so one wonders why this difference and why this inequity, and partly it's due to distribution, because the spending itself doesn't necessarily tell you exactly what is happening. It gives you an indication, but it doesn't look at the inequity within the country. You need to look at the spending as well as what the differential is within those countries. Finally, before I look at the way forward, just briefly looking at issues such as birth registration and the issue of data availability. We still find that 1 in 4 children today are not registered at birth, and that certainly has implications for later on their school registration. And the issue of registration of deaths. We've seen within the COVID-19 response the great disparity in the way countries are reporting deaths from COVID, which deaths they're reporting. And there's a lot of discussion around that. But there isn't the same discussion around whether or not countries are reporting the death of a woman during pregnancy. And still we find that many countries are not reporting the cause of death. So they're not reporting whether a woman has died during pregnancy or not. We're still relying on estimates rather than actual figures. So where do we go from here, and what are the implications in moving forward? What can be done differently?
Isabel, can I ask you to maybe finish
okay.
in the next few minutes, because time is running up very.
I was just going to give 3 very quick points.
Excellent, thank you.
First point is we need to invest in data collection. And I think that we need to build on the opportunities that are coming in through the COVID crisis to develop further within all countries the data collection systems and having relevant live data in terms of birth registration, death registration, and cause of death registration. Secondly, we need to institutionalize accountability. We've heard a lot about accountability during the COVID crisis, much blame, much finger pointing, but fundamentally there is a need for institutionalized review processes, particularly in the case of emergency, but as a fundamental where our health systems are going. And finally, we need to democratize accountability to include the voices of people from all countries. We need to build independent accountability into systems through monitor, review, remedy, and act. And particularly so that those with the least voice actually have a voice and are able to access the services that they need. We will be producing, say, the report in the middle of July, and we certainly will be making it available for you so that yourselves plus all of those that are on this webinar will be able to see it. Thank you.
Thank you very much for a very rich presentation about the different issues that deals with inequities. I won't go through them because you highlight lots of them, but just what is important to note is, similar to the previous presentation, the issue linkages of that this crisis is showing. That it's not, you cannot just fix one problem. Everything is interlinked, and you have to have a global perspective. And we look forward to reading the report. We might also put it on our webpage when it will be available. And finally, and not least, Ms. Anne Keeling. Anne?
Thank you, Jean-Marc, and thank you very much for inviting Women in Global Health. Okay, so I have my slides. I'm just need now to move them. Okay. I'm going to talk very briefly about how inequality in health, particularly gender inequality, makes the world more vulnerable to crises like COVID-19. So point number one, and I think these are all things that we already know, viruses don't discriminate, but societies do. And I think we've heard a number of examples of inequality within societies that do impact on people's health and will in the future. We've long known about the social determinants of health. Leaving people behind in a pandemic just throws a spotlight on those and amplifies something that we already know. But if we look at who is dying in this pandemic, where we have those figures, we can see that in US it's more Black Americans and Latinas. In UK it's Black people and people of South Asian origin. And that's not biological. It's connected to wider inequalities about where they are in society, the jobs they do, overcrowded housing, and also related to some of the underlying health conditions that they have, the non-communicable diseases, which are in turn connected to their place in society. And this pandemic is particularly impacting older people. So I'll talk about that very briefly. The second thing I want to talk about is how gender inequity in the health workforce is actually playing out in this pandemic, plays out generally, and is bad for everybody's health. So when we have a pandemic, I think what it really highlights is that if just one person is vulnerable, we're all vulnerable, because viruses don't respect national borders. As an example of high-income country, this is Singapore. 15th of March, Singapore was being applauded for its success in containing the virus. They had 200 cases of COVID-19. By the 20th of April, they had over 10,000 cases. And it's very interesting when you look at the figures being reported by Singapore, 89% of the infections of COVID-19 are in men. What's the explanation for this? And the explanation is clear. Singapore forgot that it had 300,000 migrant workers living in highly cramped dormitories. And those people actually, a lot of them classified as essential workers. And not possible for them to lock down and not possible for them to physically isolate. And that is where the pandemic spread, the infection spread in Singapore, and Singapore had to urgently take measures. And I think put at the bottom there that COVID-19 didn't break health systems. It's just exposed the cracks in health systems. And many of those cracks are the cracks that have been identified in the universal health coverage process. And the call for universal health coverage is for health coverage that that applies to everybody. And it's not just about averages, the health systems that reach even the most marginalized, like Singapore's migrant workers. I also want to talk about the people who deliver our health. And I think one thing that this crisis has highlighted is that the default health worker is actually a woman. And maybe that wasn't necessarily well known to people before, but 70% of health and social care workers are women, 90% of nurses and social care workers, the majority of community health workers. It's very much women that have been on the front line of this pandemic. And many of them have been on the front line without protective equipment, or with personal protective equipment that was actually designed for a male body and not designed for a woman. So despite the fact that the default health worker is a woman, societies haven't yet caught up with that fact, and health systems haven't either. But although women are the majority of health workers, they're only 25% of health decision makers. So it's a majority female profession, but women are not making it into senior decision making, and their voices are being lost, not only in this crisis, but in universal health coverage and generally. Health workers in this crisis and on a normal basis are subject to a high level of sexual harassment from the communities, from colleagues, but also from patients. Female health workers are generally clustered into lower status and lower paid jobs. They're given lower social value. Men in health on average are earning 28% more than women. That's the gender pay gap. And I think one very important fact that is a key source of vulnerability, women are contributing $3 trillion to global health, but half of that is in unpaid work. So within our health systems, particularly in low-income countries, there are women working unpaid as vaccinators, as community health promoters, community health workers, exactly the health workers that we need right now on the front line in this crisis, and that we will need to roll out a vaccine when there is one. But those women, those unpaid women, will be the first people that leave the health system in a major crisis, because they will be drawn into unpaid work and duties at home, but also if they're unpaid, it will be very reasonable for them to fear catching the virus. So our health systems are subsidized by some of the poorest women on the planet, and we need to be bringing the unpaid work that women do in health. We need to be recording it and bringing it into health systems, and rewarding it and bringing it into health systems as formal jobs. So I think what we would say is that applause is very welcome, but decent and safe work for women in the health workforce is actually what women need. And that is in the interest of everybody's health. At the moment, we are building global health on a very fragile basis of women's underpaid and unpaid work. And when a crisis as big as this one hits it, the cracks in the system are very obvious to see. We have a global health worker shortage of around 40 million health workers, and we need an additional 18 million health workers to achieve universal health coverage. We need women to be entering health worker jobs, and we need to retain them. And in order to do that, we have to fix the gender inequities in the health workforce. We're coming out of this with several key messages, and I think a number of my colleagues have covered some of these. But when we're looking at the cost of what is going to happen next, when we're looking at the economic cost of the recession, we have also to be looking at counting the cost of inequality and the cost of inaction. And that's not just for now, but it's the human and the economic consequences for future generations. If we had acted on some of the weaknesses in health systems before, this pandemic would not have hit as hard as it has. And we have to, as other speakers have said, be ready for COVID-20, COVID-21. This is not the last health crisis that we will face. Secondly, we need to consider what we value. And I think we need to consider who we pay, how we pay. Do we still value bankers more than health workers? Do we still value footballers more than care workers? Is this pandemic going to lead to a fundamental reassessment of where health and our own mortality sit in our value system? Thirdly, there is no return to business as usual. And I think all the speakers have said that, and that's absolutely clear. What if women say no to this social contract that we're asking them to sign up to? What if women say no to that burden of unpaid work that they largely carry? The women during lockdown now, and these are women in wealthy countries who are trying to manage working from home, a full burden of domestic work and schooling their children at the same time. What if women simply say, no, we're not willing to do this? What if women walk away from health and social care jobs? Fourthly, I think as Brenda said at the beginning, we don't need to ask for permission. We have member states' commitments embodied in the SDGs, and I think very importantly in last year's political declaration on universal health coverage being part of the SDGs, but that political declaration contains some very strong language and some very strong commitment that we must build on. This is not the time to be slowing down on the SDGs, slowing down on universal health coverage. It's exactly the time to do the opposite. It will take coordinated global leadership. I believe that leadership should be 50% female. And what we really need now is to build better with cathedral thinking. And this idea of cathedral thinking is that the architects, the builders of the medieval cathedrals in Europe were building buildings that they knew they would not live to see finished. And what we need now is some incredibly bold thinking about really long-term building back better for future generations. And this is our opportunity to be that generation. It's our opportunity to rethink health, inequality, and link this with climate change. But it's going to take some cathedral thinkers to really think big enough to make something of the death and destruction that people will have suffered in this crisis. Thank you.
Thank you, Anne. Basically, you mentioned that the viruses don't discriminate, but society or societies do, and you took the example of woman discrimination in the health sector. And I think your point at the end is a very valid one, that you have to think big because this crisis magnifies lots of inequities and inequalities, and if we want to rebuild, we need to do it on new grounds and link issues together. So I think these are all very good, valid points. And now we'll turn to the audience. We have about 14 minutes left for a Q&A. So Ashley, go ahead.
Great, thanks Jean-Marc, and thank you to all the speakers. We may not be able to get through all the questions in the time, but we'll try to consolidate them together. My first question, if I may invite Brenda and Lawrence to answer this question. How are we able to consolidate all the work being done on each of the SDGs to ensure equality of representation? Is there a hierarchy of SDGs? Is one more important than the other? Thank you. Brenda, maybe if you would like to go first.
Thank you. And I think it's a good question because it's recognizing that we need to look at the whole and how each one interacts with each other. And there isn't a hierarchy, it's a whole package. And you know, I think one of the challenges that we saw with the MDGs was that there were a focus on some, and as if you could do one thing and ignore the others. The SDGs is a whole package, and it's really important that it's taken forward as such, and that we understand that progress on one affects the likelihood of progress or not on another. So that's my answer to that question.
Yeah, it's Lawrence here. Yeah, it's a great question. It's a really difficult one to answer. You know, obviously you can't, an individual or an organization can't focus on all 17 at the same time. But I think most of us work in partnerships, in alliances with lots of other organizations and people. And we at GAIN, we work on food systems a lot. And so we are inevitably worried about how food systems affect health, nutrition, food security, climate, biodiversity, decent work, natural resource use, all of those things. And so I think we are saying to ourselves and to all those we work with, we have to treat these as indivisible. You can't just pick and choose which one you're interested in. The trade-offs and the synergies really matter, and they're not trivial. So I've been working with a group helping to think about the big UN summit on food systems in 2021. And I know this idea, this is one of the key principles that the summit will weave into its design, is that these 5 or 6 outcomes that food systems can generate must be treated as indivisible. So just as we treat human rights as indivisible rights, we don't pick and choose our rights, we can't pick and choose the SDGs. Over.
Thank you to both of you. The next question, if I may direct it towards Andreas and Elizabeth. One of our listeners, Jessica, has asked, the UN Peace University is creating an online community of practice around operationalizing the SDGs, particularly in the context of COVID-19. Are you, as the speakers, aware or engaged in that community, and how could this community make a difference?
Yeah, actually, the UN Peace University's work is quite well known. There are actually a number of efforts around the world to actually operationalize the SDGs. And I think these are great efforts to get young people early on debating, discussing the links and interlinkages between them to get a deep understanding. So I applaud this effort, as well as many other efforts in this area. I think many countries are actually very active. I think this is something the young generation should and can take ownership of.
Thank you. I agree with Andreas, and just to say that there are many different, there is that initiative, but there are many other initiatives in the community of practice, particularly for young people through the Partnership for Maternal Newborn Child Health. There is a young person's group. There are through Women Deliver, there is a young leadership group. So there are a number of different ways in which young people can be involved and actually can make sure that their voices are heard.
I mean, if I may add, I think one area where governments could better is to build this more explicitly in curriculum design. At the OECD in our 2030 project, we're working on this, but it's actually still quite rare. People talk about it, but you don't find a lot of, SDG thinking embedded in national curricula yet.
Very good, thank you both. My next question is directed towards Anne, but I'll also give the chance for the other speakers to come in if they wish. In an era of growing nationalism and isolation of countries, what opportunities are there for the SDGs to be that point of connection and cooperation between countries? Can global governance be achieved? Thank you.
Thank you. I think it must be, and I think the way that it can be achieved is through movements of people. And if I look at my own organisation, which is a global movement of women with chapters throughout the world, I think people are making connections in a way almost regardless of their governments at times. And I see the connections that are being made between scientists at the moment over COVID-19. It's just transcending national borders, and it has to. So in some areas, definitely, I would say we have problems with governments, and we have problems with particular governments that want to undermine multilateralism. But at the same time, we have movements of people beneath that who are making connections, and that's how we're going to go forward, I think.
Thank you. Did any of the other speakers wish to add to that question?
Maybe just to add, to say that the online platforms and the way in which the connectivity is allowing far more people to be involved than they previously were. And I know that we have heard of all of the issues of those left behind, but I think that through both national and international online platforms, we can increase that feeling and that unity of one being.
Similar to last week, and I have to say that last week's webinar, the perspective was quite gloomy on the environment. And I have to say that although we didn't reach the same level of pessimism, your contribution were also quite of concern. So maybe to end on a positive note, what gives you hope? That what will come from this crisis? May I ask you just to answer very quickly? We have about 5 minutes left, but let's do a round table or round Zoom, if you'd say. Brenda?
Thank you. And what gives me hope is people. I think, as we've heard just now in the answers to the questions, when we ask people and when we allow their experiences to come to the fore, their values are about being decent and fair and inclusive. And so as long as we stick to our agreements and people say, no, we want change in this direction. And we've seen it happen through the crisis. We've seen people helping each other and civil society making changes which governments have been unable to do. So that gives me great hope, actually. And as Liz said, people are now connected. So we can say, no, these are our values, and we want a world that values people and values what we think is important.
Great. So people, Lawrence, don't forget to unmute yourself.
Yeah, 3 things for me. First, we kind of know what to do. We know what needs to happen to build back, to deal with the immediate crisis, to see us through to 2021, and then to build back better as we keep going. We know what to do, at least in the domain that I know well. It's pretty clear. The second thing is that things are much looser than we thought. Things that were certainties, that were difficult to change, politically difficult, institutionally difficult, bureaucratically difficult. All of a sudden, we've been able to spend trillions and billions and change the way we behave at an individual level, organizational level, and societal levels. I think that gives us hope to envisage a brighter future and be bold in getting there. And I think the third thing is that, again, in the domain that I work in, I've seen an incredible coming together of people who don't normally come together. People working on health, environment, climate, nutrition, livelihoods. They have come together as one, and that's that spirit that we need to carry through past the immediate crisis. Over.
Thank you, Lawrence. Andreas?
Yeah, I must say, actually, I feel a lot of hope. I mean, in a way, this health crisis has done more and better than the climate crisis in creating collective ownership. People really taking action, people taking responsibility, not just for themselves, but for others. I think the wearing of masks is a great illustration of that. You know, it's not necessarily helping you, it's going to help others. And it's something that we can see emerging in the field of education, in my field. I have not seen in the last 15 years the amount of innovation that we see now happening at the front line. You know, as the kind of very bureaucratic industrial systems are falling apart, you can see really teachers, you know, finding new roles for themselves, students becoming more, you know, self-organized learners. I think there's a lot of innovation at the front line that this crisis is actually revealing. So I think there is hope.
Excellent. Elizabeth?
Sorry. Yeah, I think that the other speakers have already said many of the things, and maybe I will sort of lynch it into one word, which is accountability. And accountability at many different senses. Local accountability, where the community is helping each other. They are looking who hasn't got food, who hasn't got transport, etc., and they are helping each other. So they're being accountable to each other, and then building up to the next level and the next level, through to this, as Anne was mentioning before, this global collectivity in the search for a vaccine. So I think that the interconnectedness is a real positive force, but fundamentally it comes to can the global community, the local community, through mechanisms of accountability, actually override those despots, and there's not only one of them, there's plenty of them, who are trying to stifle the innovation and things that are going on. And I think that it's feasible and it's quite possible, and I think that gives us tremendous hope.
Thank you. Finally, Anne. Don't forget to unmute yourself, please. You unmute.
Apologies. Yeah, apologies. So number one, it's solidarity. Secondly, it's an understanding that health matters, and that includes mental health. I think it's another thing we're gonna learn from this, and that universal health coverage is not just a nice to have. It's central. It's fundamental. And then thirdly, I would like to see an appreciation for women's leadership. I think we've seen that some of the political leaders who have done best in this crisis have been women leaders. I think there is a growing appreciation of that, but I would like to see that as more widespread. Thank you.
Thank you very much to all of you. I think it was very rich in terms of content and insight, and I'm sure that our viewers can take a lot from this webinar. Next week, and so thank you for your contribution. Next week's topic will be one that basically will in a way answer or address the last question that was raised: can global governance be achieved? Because we'll talk about the impact of COVID-19 crisis on multilateralism and international Geneva. The issue with the World Health Organization and the United States has demonstrated that there are some issues in terms of international and global governance. And is it magnifying already existing trend, or is there a new normal? So these are the things that we'll talk about. It will be on Thursday, 28th of May at 2 p.m. Central European time. Until next week, you can watch this webinar again on our YouTube channel or on our website. And if you want to sign up for the next seminar, you can do it on our website as well, gcsp.ch. So until next week, stay safe, and I'll see you next week. Bye.